After 2.5 years of daily home dialysis treatments, Tammy Seward was ecstatic to finally receive a kidney transplant. But a day after returning home from the hospital, her body began rejecting the donor organ.
It's hard because you think, oh, you're going to get this kidney and you're going to be okay and you don't have to do it no more. And then that rejection came in within like 6 days or 7 days.
About 1 in 4 transplant patients develops antibodies that attack the donor organ, making it more likely that the transplant will fail.
The antibody can cause immediate damage to the organ or acute rejection, and it can also cause long-term graft rejection, which means that that patient's organ is not going to last as long.
Dr. Ginny Bumgardner and her team at the Ohio State University Wexner Medical Center examined why these antibodies develop in some patients and not others, and in a new study discovered an immune cell that inhibits the development of antibodies that may predict a patient's likelihood of organ rejection.
This cell type was very interesting because it had the capacity to reduce antibody production in transplant recipients.
Those with high levels of the cell were less likely to develop harmful antibodies and the complications that come with them. Researchers hope the discovery of the cell will not only assess risk of organ rejection, but will lead to therapies to reduce that risk.
If we increase the number of these cells in the patients who seem to have a relative deficit of them, would that prevent them from developing antibody after transplant?
Tammy is back on the transplant list and is hoping this research can help her and the more than 110,000 others waiting for a life-saving organ.
That'd make my day and make me happy that you can do that and not to reject another kidney.